Have you ever noticed how the question, "Am I big enough?" seems to linger in the minds of so many men, young or old? It's whispered in locker rooms, searched millions of times online at 2 a.m., and quietly carried in the silence of relationships. For some, it's a fleeting insecurity. For others, it becomes an obsession, stealing confidence, intimacy, even joy from everyday life. I've spoken with men in their 60s who still worry about the same thing they worried about at 16. And here's the surprising truth. Most of these men fall within the normal range, yet they carry a weight that feels anything but normal. Why is that? Because this isn't just about anatomy. It's about self-image, comparison, and the distorted expectations we absorb from places like pornography, media, or even our own imagination. Now, I know what many of you are probably thinking. Okay, but is there really a proven way to make it longer or bigger? That's the million-dollar question. And it's also the trap. When we chase quick fixes, we often stumble into dangerous territory filled with empty promises, unlicensed procedures, and risks that can last a lifetime. But don't worry, this isn't just another lecture on averages and statistics. In today's journey, we're going to look at what science actually says about size, the safe and unsafe options that exist, and just as importantly, how the mind often plays a bigger role than the body itself. Along the way, I'll share real stories, surprising lessons, and insights that go far beyond numbers on a ruler. Because at the end of the day, this conversation isn't just about enlargement, it's about reclaiming confidence, protecting health, and learning to live fully without letting anxiety dictate our self-worth.
Part 1. Why size feels so central. Imagine for a moment, a man in his late 50s, married for decades, a father of grown children. On the outside, he looks confident, but in quiet moments, he wonders if his partner secretly wishes he were bigger. He reads articles, stumbles across ads for miracle pills, and compares himself to impossible standards online. He never talks about it, but the insecurity gnaws at him. He's not alone. In fact, surveys involving tens of thousands of men reveal something astonishing. More than half are dissatisfied with their size. Yet, when their partners were asked, the overwhelming majority, over 4 out of 5, said they were perfectly happy. This mismatch tells us something profound. Often the problem isn't with the body, but with the way we see ourselves. And here's where things get tricky. Modern media, especially pornography, has reshaped our expectations. It paints a picture of normal that is far from reality. We end up measuring ourselves against an illusion, and when reality doesn't match, shame takes over. But what is actually normal? Science gives us an answer. When researchers compiled data from around the world, they found the average erect length to be about 5 inches. Yes, 5. And while there's natural variation, most men fall comfortably within a healthy range. In fact, the medical definition of an abnormally small size, something called micropenis, affects far less than 1% of the population. So why do so many men, ordinary men, still carry such heavy anxiety? The truth is that this isn't just about numbers. It's about identity. It's about masculinity. It's about the stories we've been told since adolescence about what makes a man enough. Some men spend hours every day worrying about it. Psychologists even have a term, small penis anxiety. And while it sounds almost humorous at first, the reality is heartbreaking. Left unchecked, it can interfere with work, relationships, and even mental health to the point of depression or worse. Think about that. Something as small as a measurement on a ruler can weigh heavier than years of success, love, or wisdom. That's how powerful this narrative can become. And yet, here's the hopeful part. Just as anxiety can take root in the mind, healing can begin there too. Therapy, education, and open conversation often do more to relieve suffering than any device or surgery. When men learn what's truly normal, and when they begin to untangle their worth from size, something shifts. They begin to live freer, love better, and worry less. So before we talk about treatments, extenders, or surgery, we have to pause and ask, what's really driving this obsession? Is it the body, or is it the belief? This is where our story turns, because yes, science does have answers about what can and can't change, but the deeper lesson, one that matters whether you're 25 or 75, is that confidence is rarely measured in centimeters.
Part 2. The information minefield, and why caution is critical. Picture this. You're sitting at your computer late at night. Curiosity turns into a Google search. You type in, how to make it bigger, and suddenly your screen fills with promises. Gain 3 inches in 30 days. Guaranteed permanent results, no risk. Secret methods doctors don't want you to know. The marketing is loud, colorful, and persuasive, but behind those flashy words often lie half-truths, exaggerated claims, or outright scams. And here's the harsh truth. When it comes to something as personal and sensitive as men's health, desperation makes us vulnerable. When you feel insecure, you're more likely to click that ad, buy that pill, or trust someone offering a quick fix. I've spoken with men who have spent thousands of dollars chasing miracle solutions, herbal capsules, unregulated injections, even unlicensed surgeries, only to end up with disappointment, complications, or lasting harm. Why the internet makes it worse? The internet is both a blessing and a curse. On one hand, it gives us access to more information than ever before. On the other, it drowns us in noise. For every medically sound article, there are 100 more filled with misleading claims. Add to that online forums where personal anecdotes get mistaken for scientific proof, and you have a recipe for confusion. A man might read a post from someone claiming, "This cream worked for me," and take it as fact without realizing the poster might be a paid promoter or simply someone who imagined a difference. When you're already anxious, hope can blind you to red flags. The cost of quick fixes. Let me share a story. A man I'll call Daniel went abroad to undergo a cheap enhancement procedure he found advertised online. It promised him length, girth, and a new sense of masculinity. The clinic wasn't regulated, the surgeon wasn't licensed, and the aftercare was non-existent. Within a year, Daniel developed scar tissue that made intimacy painful. He spent more money trying to correct the damage than he ever would have spent on therapy. And sadly, Daniel's story is not unique. I've read about men who injected substances into their bodies that caused irreversible damage. Some experienced deformities, chronic pain, or even loss of function. When you look closely, these so-called solutions often solve nothing. They create bigger problems. What the experts say. Here's something most people don't know. The Sexual Medicine Society of North America, a leading authority in the field, officially states that penile lengthening or girth enhancement procedures are experimental. That means they are not recommended for routine use except in the rare case of micropenis. So if someone claims to have a guaranteed, safe, and proven method outside of a research setting, that's your signal to step that and question their credibility. True medical innovation doesn't come with a flashy banner ad. It comes with years of research, clinical trials, and careful oversight. The safer path. So what can you do if you're struggling with these insecurities? The first step is to consult professionals you can trust, a urologist who understands men's health, and a psychologist who can help untangle the anxiety from the reality.
That combination not only protects your body, but also gives you a clearer picture of what's truly possible, what's risky, and what might not even be necessary. And here's an important transition, because now that we've cleared the fog of misinformation, it's time to look at what is supported by science. What non-surgical options exist? Which ones have evidence behind them? And which are more myth than medicine? Let's move into that now.
Part 3. Non-surgical options and what the evidence really says. Now that we've peeled away the noise and exposed the danger of miracle solutions, let's talk about what can be done safely without going under the knife. And let me be clear up front, none of these options will turn you into a different person overnight. The results, when they exist, are usually small. But sometimes even small changes can matter, especially when combined with a healthier mindset. There are 4 main categories that tend to come up: psychological counseling, penile extenders, vacuum devices, and injections. Let's take them one by one. A. Psychological counseling. Healing the mind before the body. If you take nothing else from this entire conversation, take this. Many men discover that therapy, not surgery, is the real key to feeling bigger. When men seek counseling, whether with a psychologist, sex therapist, or even through structured support groups, they often learn 2 powerful things. 1, they are already within a normal range. 2, their anxiety about size has far more control over their lives than their anatomy ever will. I remember reading about a study where men who only went through counseling, no devices, no surgeries, ended up dropping the idea of enhancement altogether. Once they understood averages, talked openly about fears, and reframed what intimacy meant, they realized they didn't need to change their bodies to feel whole. Here's a simple example. A man in his 40s, I'll call him Robert, came into therapy convinced his size was ruining his marriage. After months of working with a counselor, he learned how to communicate with his partner, confront his unrealistic expectations, and practice body acceptance. By the end, he didn't just feel better. His relationship improved too. His partner later admitted she had never been unhappy with him in the first place. That's the power of shifting perspective. B. Penile extenders. The one device with real data. Out of all the gadgets you see advertised, traction devices, commonly known as penile extenders, are the only ones with consistent evidence behind them. Here's how they work. You place the penis in a device with rods that apply gentle, constant tension. Over time, think months, not weeks. This traction stimulates tissue remodeling, much like how braces slowly shift teeth or how stretching routines can improve flexibility. But let's keep it real. The results are modest. Most studies show an average gain of about 2 centimeters in stretched flaccid length. For some men, that feels meaningful. For others, it feels like a lot of work for little payoff. The catch? Consistency is brutal. You need to wear the device for several hours each day. You must stick with it for months. Even then, there's no guarantee you'll see noticeable results. And yes, side effects exist. Numbness, bruising, discomfort. Some men quit early because the process is just too tedious. One patient story I came across always sticks with me. A man named Kevin invested in an extender and wore it for 6 months, religiously. He gained about 1.5 centimeters. Small, but enough to give him confidence. When I asked what made him keep going, he said, "It wasn't even the gain. It was the feeling that I was finally doing something about it. That sense of control mattered more than the number." That's worth remembering. Sometimes the biggest change isn't physical, but psychological. C. Vacuum devices. Useful, but not for length. Vacuum erection devices are commonly used to help men with erectile dysfunction. They work by creating negative pressure, which pulls blood into the penis and produces an erection. But when it comes to permanent enlargement, the science is clear. Vacuum devices don't work for length. That doesn't mean they're useless. For men struggling with erectile function, these devices can restore intimacy and confidence. But if your goal is to add length, this isn't your answer. It's important not to confuse tools designed for one purpose with miracle claims for another. Just because something improves function doesn't mean it changes structure. D. Injections. This is perhaps the most dangerous category. Over the years, all kinds of substances have been injected. Fats, fillers, even experimental stem cells. Some men chase these options hoping for quick girth or length increases. But the reality is chilling. Complications can appear years later. Scarring, deformities, pain, and even permanent loss of function are all reported. Studies are limited, inconsistent, and often poorly designed. One case that broke my heart involved a man who had filler injections in his 20s. At first, he thought it looked better. By his 40s, scar tissue had formed, causing pain and erectile difficulties. Corrective surgery couldn't fully fix the damage. This is why urologists strongly warn against penile injections outside of clinical research. The risks far outweigh the uncertain rewards. So, let's pause here. What do we see? Out of all the non-surgical methods, only counseling and traction devices show meaningful, reliable benefits. Counseling changes your mindset. Traction may give a small but measurable gain if you're disciplined enough. Everything else, vacuum devices, injections, creams, or pills, either don't work for size or come with serious risks. But what about the next level? The surgical route. That's where many men look when they want big results. The question is, do surgeries really deliver, or do they create more problems than they solve? Let's turn to that next. Part 4. Surgical options and their realities. If non-surgical methods feel slow, limited, or unsatisfying, it's natural that many men start wondering, well, what about surgery? Isn't that the ultimate solution? The idea makes sense on the surface. After all, modern medicine performs miracles every day. We replace hearts, reconstruct faces, restore eyesight. So surely adding a few centimeters of length can't be that complicated, right? The truth is more sobering. Penile surgery exists, yes, but it comes with risks that most men never anticipate. And unlike a hip replacement or cataract surgery, these procedures are not considered routine. They remain experimental with unpredictable outcomes. Cutting the ligament, the most commonly discussed procedure. Let's start with the most talked about option, the suspensory ligament release. Anatomically, the penis is tethered to the pubic bone by a band of connective tissue. By cutting this ligament, surgeons can allow more of the shaft to drop, giving the illusion of extra length. On paper, it sounds straightforward. In reality, it's anything but. The gain is modest, usually in the flaccid state. The erect length doesn't necessarily change. Stability changes. Some men lose upward angle or rigidity during erection, making intimacy awkward or less satisfying. Scarring is possible, and the final cosmetic appearance may not meet expectations. One man I read about flew overseas for the procedure. He was promised 2 inches of gain. What he got was about 0.5 centimeter of visible difference, and a penis that no longer pointed upward when erect. For him, the trade-off wasn't worth it. Grafts, flaps, and fat transfers, borrowing from the body. Other surgical techniques involve moving tissue from one part of the body to another. Surgeons may graft skin, fascia, or even rib cartilage into the penis to add length or girth. Fat transfers are also common, taking fat from one area, like the abdomen, and injecting it into the shaft. The problems? Grafts may fail or be absorbed unpredictably. Fat can clump unevenly, leaving lumps or irregular contours. Cartilage and flaps require complex surgery and can leave scars and donor areas. Infection, pain, and long healing times are real risks. And because results vary so widely, patient satisfaction tends to be low. For every man who's pleased, another is left disappointed or worse, harmed. Rib cartilage experiments. One of the more extreme methods involves carving rib cartilage into a shape and implanting it as a scaffold to lengthen the penis. While technically fascinating, it highlights just how experimental this field really is. Few centers attempt it, and long-term safety data is sparse. Imagine going through major surgery, weeks of recovery, and permanent implants, only to discover the improvement is marginal or cosmetically unsatisfying. That's the gamble men face when they go down this road. Why clinical trials matter? At this point, you might ask, if these surgeries are risky, why do they exist at all? The answer is research. Surgeons and scientists are trying to find safe, effective methods. But that's precisely why experts recommend that if surgery is considered, it should only happen within a clinical trial. Clinical trials come with safeguards. Ethics boards, IRBs, ensure procedures are monitored for safety. Adverse events are tracked and published so future patients have real data. Patient selection is controlled, reducing the chance of reckless or unproven interventions. Without those safeguards, men are essentially experimenting on themselves, often at great financial and personal cost. The emotional toll of failed surgeries. One of the saddest realities of penile surgery is the psychological aftermath when expectations aren't met. I've spoken with men who went under the knife believing they'd finally solve their insecurities. Instead, they ended up with scars, complications, or disappointing results. The sense of regret and shame can be heavier than the original anxiety. It's heartbreaking, because the very men who were already suffering from insecurity often end up worse off. What was once a private worry becomes a visible, permanent reminder. Bottom line on surgery. So where does this leave us? Yes, surgical techniques exist. Yes, they can create modest changes in appearance, but they carry high risks, inconsistent results, and potential lifelong consequences. For the vast majority of men, surgery is not a recommended path unless it's part of carefully monitored clinical research. And this brings us to the real turning point in our journey. If drastic surgical solutions are too dangerous, and if non-surgical methods only offer modest results, what should men actually do? This is where perspective shifts, because sometimes the most important work isn't about centimeters. It's about mindset, health, and reclaiming confidence in ways that don't involve scalpels or machines. That's exactly what we'll explore next.
Part 5. Real stories, practical lessons, and human truths. By now, we've covered what's scientifically possible and what's dangerously misleading. But science alone doesn't tell the whole story. To really understand how these issues affect men, we need to look at real lives, men who tried, struggled, succeeded, or regretted their choices. Their stories shine a light on why this topic matters so deeply and what lessons we can carry forward. Story 1. The 1 centimeter dream. Jason, a man in his late 40s, had lived with quiet insecurity for decades. He wasn't clinically small, he measured right around the global average, but he couldn't shake the feeling that he was inadequate. When he found a traction device online, he thought, "This is it. Finally, I'll fix this." He committed himself, wearing the device 3 to 4 hours daily for half a year. At the end of his effort, he gained about a centimeter. By scientific standards, that was a success. But Jason was devastated. He expected a dramatic transformation, not a modest gain only noticeable with a ruler. His disappointment taught him, and later others, that the problem wasn't really his body, but the weight of his expectations. He'd been promised an inch, maybe 2, but what he really needed was perspective. Lesson: when you chase perfection with unrealistic expectations, even small successes can feel like failures. Story 2. The injection regret. Luis was in his 20s when he decided to try filler injections. At first, he felt thrilled. His girth looked slightly larger, and he believed it gave him an edge in confidence. But within a few years, lumps began forming. The material hardened under his skin. His erections became painful, intimacy grew difficult, and his anxiety worsened. By his 40s, he required corrective surgery to remove scar tissue. The procedure helped, but the damage could never be fully undone. Luis often said his greatest regret wasn't the procedure itself, it was the silence that led him there. He didn't talk to a doctor, didn't ask questions, didn't share his fears. He just acted. Lesson: quick fixes often trade short-term relief for long-term pain. Silence and secrecy make poor guides. Story 3. The therapy surprise. Ethan, a man in his 30s, walked into counseling ready to pursue surgery. He was certain size was the barrier in his marriage. His wife reassured him countless times that she was satisfied, but he couldn't believe her. During therapy, Ethan learned about averages, discussed the distortions of pornography, and practiced communicating openly with his partner. Slowly, his perspective shifted. Months later, Ethan realized he didn't want surgery at all. What changed wasn't his size, it was his relationship with himself. His wife later admitted she felt more connected than ever, not because of physical changes, but because Ethan was finally present, confident, and open. Lesson: sometimes the most powerful transformation is internal, not external. Story 4. The silent generation. I once spoke with a man in his 70s who admitted he had lived his entire life with a quiet sense of shame. He never sought treatment, never asked questions, never even spoke about it, not with his wife of 50 years, not with his closest friends. When he finally opened up in a men's health group, he said something that struck me deeply. I wasted decades worrying about something that was never a problem, and I don't want younger men to waste their lives the way I did. His words echo in my mind whenever I think about this subject. Because behind every statistic, behind every average length study, there are real men carrying silent burdens that don't need to be carried. Lesson: time is too precious to waste on shame. Openness and knowledge can free us long before drastic measures ever could. Pulling the stories together. What did these stories reveal? That devices and surgeries often give less than what people expect. That miracle fixes frequently lead to regret. That therapy and open communication often heal more than medical interventions. And that silence is the heaviest weight of all. These men's journeys teach us that while science matters, perspective matters more. And if we listen carefully, their lessons can spare others years of anxiety, money wasted, or even permanent harm. So where does this leave us?
We've seen the risks of misinformation, the modest gains of non-surgical methods, and the dangers of surgery. We've also seen how the mind, our beliefs, our expectations, our silence, can be both the cause of suffering and the key to relief. Now it's time to bring everything together. In the final section, we'll distill the truths, explore the lessons, and outline what every man, young or old, should know before chasing centimeters. Because at the end of the day, this isn't just a story about size. It's a story about health, dignity, and the freedom to live without chains of insecurity.
We have traveled a long road together, from the silent insecurities so many men carry, to the promises and pitfalls of enlargement methods, to the stories of real men who chased answers in different ways. Now it's time to gather these threads and turn them into lessons that can guide anyone listening, whether you're 25, 55, or 75. 1. Your worth isn't measured in inches. The single most important truth: size does not define you. The science is clear. Most men are well within the normal range. The problem is not usually anatomy, it's the distorted standards we've absorbed over years of comparison. Think about it. Your partner's satisfaction depends far more on intimacy, connection, and confidence than on measurements. Study after study shows this, yet the myth persists. Breaking free starts with remembering that you are more than a number. 2. Knowledge is power. Ignorance is a trap. When you don't know the facts, you're vulnerable. That's when shady clinics, miracle pills, and flashy ads slip through the cracks of your doubt. Education, understanding what is normal, what is possible, and what is dangerous, is your strongest shield. Every man should know. Average erect length is about 5 inches, or 13 centimeters. True micropenis is rare, under 1%. Only traction devices have shown small, consistent results. Surgery and injections carry serious risks and should only be attempted in clinical trials. When you know these truths, you can filter lies from reality. 3. Small gains come with big commitments. Yes, traction devices can add about 1 to 2 centimeters over months of consistent use, but they demand discipline, hours a day for half a year or more. That's a big investment of time, energy, and patience. And even then, the change may not transform your self-image. Which brings us to the next point. Mind first, body second. So many stories we explored showed the same pattern. The body wasn't the real problem. The mind was. Counseling and therapy consistently reduce anxiety, improve relationships, and help men accept themselves. Before you spend money, risk surgery, or put your health on the line, ask, have I invested in my mental well-being? Have I spoken openly with a therapist or even my partner? Chances are the freedom you're chasing lies in self-acceptance, not centimeters. 5. If you do seek medical help, do it the right way. For the very small group of men who may pursue medical solutions, only consider trusted, licensed urologists. Avoid unregulated clinics or overseas quick fix offers. If surgery is on the table, make sure it's part of a clinical trial with ethical oversight. Demand transparency about risks, complications, and long-term data. Your health is worth protecting. Never gamble it on false promises. 6. Don't let silence steal your life. The quiet shame so many men carry is often more damaging than the issue itself. Staying silent keeps you stuck. Speaking up opens doors to knowledge, reassurance, and healing. Remember the man in his 70s who admitted he wasted decades worrying in silence? Don't let that be your story.
time is too precious. Wrapping it all together. So where does this leave us? Here's the bottom line. Most men are already within the normal range. Insecurity is common, but it doesn't mean you're abnormal. The only proven physical method, traction, offers small gains with great effort. Surgery and injections remain risky and experimental. The most powerful treatment is often psychological: therapy, education, and communication. And perhaps the greatest lesson of all, true masculinity, true confidence, and true intimacy, they aren't built on centimeters. They're built on connection, self-respect, and the courage to live without shame. So, if you've listened all the way here, let me say this: you are not alone. The questions you carry have been asked by countless men before you. The anxiety you feel has been felt by others, and the relief you seek is within reach, sometimes in ways you never expected. Take care of your body, yes, but take even greater care of your mind and your spirit, because in the end, the real goal isn't a number. The real goal is freedom. The freedom to love, to live, and to accept yourself fully. So here's my challenge to you. Don't let this conversation end when the video stops. Take one small step today. Maybe that's having an honest talk with your partner. Maybe it's booking a consultation with a professional. Or maybe it's simply giving yourself permission to stop comparing and start appreciating the body you already have. And if this message spoke to you, if it lifted a weight off your shoulders or gave you a new perspective, then share it. Because I promise you, there are men out there quietly struggling with the same questions, and they need to hear that they're not alone. Subscribe so you don't miss more conversations like this, not just about size, but about health, confidence, and living fully at every age. Drop a comment below and tell me, which part of today's message resonated most with you? Remember, your worth isn't defined by inches. It's defined by how you choose to live, love, and take care of yourself. You deserve that freedom. You deserve that peace. And it can start right now, with you.